Hi guys, I just wanted to check in today. It is, I don't know where my watch is. I took my really expensive Apple Watch off before finals, because the week before finals, because I wanted to use my nursing watch because it has a different, I really like having just the dial, and my Apple Watch kept turning off. It was very obnoxious, so I bought a specific nursing watch, and I can't find my Apple Watch. It's here somewhere. I just don't know where I put it. So I wanted to tell you a few other things. I wanted to finish out this week on EMT because I wanted to move past the education part of it. I'm happy to answer any questions you guys have. If you ever want to know anything about EMT school or EMT supplies or skills you can practice or anything about EMT that I just went through, I'm happy to answer any of those questions. Just comment and I'll answer them at any time. But I want to be able to get through this week because all of the testing is done. I do have to take my boards, but that is in the future, so we'll focus on that in the future. Right now, I am just enjoying that weight being off of my shoulders, because I am very happy to be done and to have that knowledge. Let's see. I was going to tell you a few other things I'm buying for my specific jump kit, because I'm going to be using my skills volunteering a lot. Like, I'm not planning on working full-time anytime soon, maybe not even part-time, just PRN, which is like 1 day a week, maybe 2 days a week, and then people can call me if they need shifts picked up. And that's in the future. Since I have all of this knowledge now, what I really wanted to do with it is to be able to help my community and my friends and my family, especially through COVID crisis and any other issues that come up along the way. So I have all of my regular jump kit equipment, and you can watch the last video that I did about that. But the other things I wanted to tell you that I'm getting is I am also buying a $60 otoscope. And what that is when you've gone to the doctor's office and they have that thing, they pull it off the wall and they look in your ears and they look in your throat and they look in your eyes and look up your nose. That's what that is. I want to be able to do those things for my friends and family, like if they have kids that they suspect have an ear infection, or that they might be looking strep throaty. I mean, obviously I don't need an otoscope to look down your throat, but having one to look makes a big difference. And my husband asked me what I wanted for Mother's Day, and I told him medical equipment because I want to be prepared if someone needs help. And I didn't want to spend a fortune on medical equipment. Like, I really want to, I ordered the otoscope and I don't remember the other part that goes on the top that lets you look in the eyes, that has the magnifier. I have that as well. And then I also, what else did I order? The other things that I would get to put in my jump bag is a cervical Cspine collar. And one thing that I learned through EMT classes, you always think before you go through these classes that C collar is meant to keep them, to actually immobilize them. And what it actually does is it just is there to make it harder for them to move. It doesn't completely immobilize someone, but it does remind the patient to not move their head, and it does slightly immobilize. They're very uncomfortable, but they're highly necessary in certain situations. So a cervical C-spine collar is in a jump kit. Got a picture for you. Next are these oral airways. These are, think about your tongue. It's a big old muscle. And when it's in your mouth, it's even bigger and flatter. And so if you're having breathing problems, these are an airway that you can quickly get in to get their tongue down and out of the way if they were having like a seizure, or if you felt it was comfortable and safe to put one in as a seizure, or if they were choking and they needed to have their airway protected but didn't need like an intubation or anything like that. Or that leads on to my other thing. There are something called nasal pharyngeal, or what are those called? They're a tube that goes up your nose and down into your oral cavity back here to get past your tongue. So if you need to breathe, you can do that. Those are called pharyngeal airways. Anyway, then the last airways that I would want to do in my jump kit in the long run are either the King's airway or the iGel airway. But those are in my area within an EMT scope of practice. So I can intubate you if I need to with 2 different intubation tubes, 2 different kind. And let's see, next in the jump kit, I would want to have a bag valve mask, not just a CPR mask. This is the bag that goes onto their specific bag valve mask, because if I'm in an emergent situation and it's only me and I'm trying to do 5 different things, I can do a bag valve mask with one hand and be doing a ton of other things over here with what I need to be doing. One for infants and one for adults. And then thermometer, duh. I forgot to get a thermometer. I want a good one that is reliable, that I can count on. Let's see, what else? When you think about first aid supplies, you can get, I don't think of emergent supplies, but first aid supplies are a part of that. And that is things like compression bandages, to stop bleeding, roll bandages, trauma pads, which are big bulky bandages that have like clotting agents in them. There are triangle bandages, there are splints, there are for broken bones. All of those types of things you can buy first aid supply kits. I'll put 2 up here that you can take a look at. They're around $150. To get a decent one. Let's see. I think that's all that I would put in my kit. I mean, oxygen, but I can't carry around oxygen. I think that's it, y'all. That is all I would need in the first 10 minutes of an emergent situation that didn't carry medication. Yeah, that's how I feel. Oh, but you definitely need a tourniquet. You need a cat tourniquet or any kind of tourniquet, a real one, and you need to know how to use it and put it on properly. And you always write the date on it. Not the date, the time that you put it on.